Oh, happy Mother's Day. Today I want to talk to you guys about having a low oxygen. So basically, when we have patients that come to the clinic and the main referral reason was that her oxygen saturation has been low, and low meaning that has been below 90%. Basically, we have to start thinking of all the possible reasons to have such a low oxygen level. Number one, if a patient has recently had that and is having more shortness of breath, the main question is, are we having a blood clot? Are we having an embolism? If they were doing good, out of the blue, they had a long distance trip, they were sitting for too long in an airplane, they were sitting for too long on a car ride. Basically, if you're sitting without getting up for several hours, there's a risk that you might have a blood clot on your legs, and as that blood clot breaks, it can become a pulmonary embolism. And a pulmonary embolism is a reason for a patient to have low oxygen, have shortness of breath, breathe very fast, have a high and fast heart rate. So always, if you have sudden onset of shortness of breath with a low oxygen, you have really no time to go and make an appointment. You have to go straight to the hospital, go to an emergency room, so they can evaluate you for this. Sometimes if this is something that you've been noticing for several months, it could be emphysema, COPD, chronic obstructive pulmonary disease. A type of that is called emphysema. And some patients with emphysema have a low oxygen level. And that's basically from a chronic smoking history. Other risk factors are also involved to have emphysema. Younger patients that have emphysema sometimes have something called an alpha-1 antitrypsin deficiency, but emphysema could cause a low oxygen. Also, a pneumonia. If you're starting to have a cough with phlegm, you feel some rattling on your chest when you're breathing, you have fevers. Again, low oxygen is because there's something involved in your lung from the pneumonia, and that causes low oxygen in your body. So low oxygen can be a blood clot, could be emphysema from COPD, it could be a pneumonia, it could be congestive heart failure, it could be you could be so much volume overloaded that your oxygen is also affected. And what's the easiest way to check it? Well, they sell a pulse oximeter. That is a little device that you can put on your finger, and it can tell you your oxygen level and your heart rate. So that's something to have available, that anytime you have difficulty breathing, put that on and check if the oxygen is low. Because if it's low, you need to call your doctor, you need to go to an emergency room. Depending on how fast and how sudden it is, you know what to do. If it's too sudden, you go to an emergency room. If it's something that's been slowly happening, definitely don't disregard it, but you need to make an appointment with your doctor so they can evaluate what's going on. Some people, again, they can have low oxygen because of fibrosis. They have your chronic dry cough. You have, when they listen to your lungs, they have some crackling sounds on your lungs when you breathe in. And pulmonary fibrosis is well known to have and lead to low oxygen levels. Some people have pulmonary hypertension because of several reasons, but pulmonary hypertension can also cause a low oxygen level. So always, again, if you have a chance to buy one of those pulse oximeters, check that level and have a baseline level of how you are good. If you're always around 97, that's perfect. But if out of the blue you're having shortness of breath, and when you're putting that on your finger, the oxygen is now low, there's a sign that you need to get evaluated. Sometimes women, if they have too much nail polish on their fingernails, sometimes it can be a lower oxygen level. So again, if you have low oxygen levels without much symptoms, you need to always think of all the possible scenarios. But sometimes having too much of nail polish, darker colors, can affect the level of oxygenation too, that you check on that pulse oximeter. So low oxygen levels are also never just normal. We need to evaluate them. And most of these videos are meant to have a little preview homework for patients as they go and get evaluated by their doctors. These are never meant to treat you at home. This is mainly so you know what to expect, what questions to ask, what to have thinking already is going to happen when you go see your doctor. But always have that face-to-face visit with a primary doctor, with a pulmonary doctor, with a doctor that needs to examine you, listen to you, and give you an overall evaluation. Okay? And please, if you want to comment on any topics that you would like to talk regarding the lungs, please comment them and I will be more than happy to make videos about them. Okay, once again, happy Mother's Day. I'm actually ready to go see some patients at the hospital and talk to you guys later. Bye bye.